Gurmila Mahagut Ceann Comhairle, and can I take this opportunity, Ceann Comhairle, to offer my sincere condolences to the family and friends of jockey Pat Smullen. His death has brought deep sadness to the horse racing community and indeed far beyond that. And as we all know, Pat fought his own battle with pancreatic cancer, but he also raised more than €2.5 million for treatment and research into that disease. So it's fair to say that Ireland really has lost a champion both on and off the racecourse. So our Yeshjay Gorev Anam. Taoiseach, yesterday was billed as a day to bring clarity and forward planning. And instead what we got was chaos, confusion and very considerable anxiety for people. Can I say that I am very glad that Minister Stephen Donnelly has had a negative result for his COVID test. And I'm also very glad that the Minister got that result within a matter of some hours. I think that it has to be said that that experience does not tally with people more widely across society. And I make that point because 24-hour turnaround of results has to become the standard, the universal standard for everyone in society. Taoiseach, last April, your colleagues in government, Leo Varadkar and Simon Harris, told us that we would reach 100,000 tests per week. You will also know that the COVID committee made a recommendation on the advice of experts that 24-hour turnaround for results would be achieved and observed. Now, we are months later and neither of those two important commitments have been met. And very disappointingly, yesterday, your plan, your very lengthy plan, was very sketchy in respect of testing and tracing. You had no concrete targets, no concrete delivery plans in this area. And I emphasise this area to amplify the basic public health advice, which is as follows. To deal with this crisis, to get ahead of this virus, to flatten the curve, to keep it flattened, you must test, trace and isolate. That's what the World Health Organization tells us, and they are correct. So in that spirit, Taoiseach, can I ask you, when will we get to 100,000 tests a day? And what's your target beyond that? Because 100,000 won't be enough. The All-Party Committee, as I said, recommended 24-hour turnaround time for results. When are we going to get to that? Can you clarify those matters for the Dáil this morning? Because we need to get this basic central element right. I'm very glad that we're back in the Dáil, Ceann Comhairle, after yesterday's shambles. I think the public were left with a real sense of unease, seeing the Cabinet unable to work and the Dáil suspended. And I also think that people have lost confidence in your government's handling of this emergency, and not least here in Dublin, where you've left people hanging in a very, very cruel limbo. It's not just that people are confused, people are beside themselves, Taoiseach. People whose businesses are hanging by a thread, people whose jobs are in the balance, people who want to have social contact with friends and family. And there's no clarity yet as to whether people can come or indeed go from the city. The message from your press conference was that people shouldn't move outside of Dublin. And then Minister Donnelly said the opposite. And then you were unclear last evening on RTE. And then again this morning, we have two senior ministers contradicting each other within a matter of hours, Minister O'Donoghue and Minister McGrath. So it's an absolute mess. And I think, Taoiseach, you need to be straight with the people of Dublin. You need to tell them what exactly we're facing. Deputy, and we need that clarity and certainty now. So can you do that? Can you provide that clarity? What are the current restrictions? And will we be facing further restrictions when NEFIT meets or when your new committee meets? And we also now commit, as I've asked, to seriously ramping up in a concrete way our testing and tracing capabilities.
Thank you, Deputy Taoiseach.
First of all, I wish to express my deepest sympathies to
the wife and family of Pat Smullen, to Francis and his family, an iconic figure in the racing world who is deeply mourned by his family and his friends, and salute his absolute courage and commitment to cancer care and to taking on what was the greatest challenge in his life. Could I also say that just because the Deputy says things doesn't mean they're true. And the Deputy has a habit of deliberately distorting and undermining genuine and significant efforts in relation to dealing with COVID-19. And in her own commentary as well and contribution, tends to evade the hard questions as well, particularly in relation to Dublin. And I look forward to the Deputy's support next week, whatever advice comes from NEFIT, and I would appreciate that support as the government may implement that particular advice. But what I want to say in relation to testing is this, that today the HSE will have now surpassed the 1 million tests in this country. 1 million tests have taken place. Last week saw a 70% increase in community testing requests from GPs. And it has managed to deal and cope with that. Obviously, the return of our schools has created additional pressures, as they do all over Europe. Interestingly, the positivity rates for children tested between 0 to 14 is less than 1%. There's a daily capacity there now at 15,000 for community and acute hospitals. And the HSE will say that that's more crucial than the 100,000 weekly figure as they work within a 15,000 a day. And 11,000 of this is for community where the spike was, and the remainder is for capacity in our acute hospitals. And it's been quite significant in terms of what has been achieved to date. This week, so far, has seen further increases in testing requests, but there is more swabbing capacity in place, testing sites ready to deal with it. On average, again, there will be 10,000 community swabs per day alongside 3,000 in hospitals. 12,000 tests are expected from nursing home serial testing, 4,000 from meat plants, 3,000 from direct provision. And this week, the HSE will see their highest number of swabs taken and tests processed ever, and will continue to improve. So let's acknowledge the significant ramping up of the testing system. There's road to go yet. It was set up in mid-flight as the pandemic took hold. And you made a statement that you said the plan was sketchy. The plan is not sketchy. The plan is very specific in terms of creating a dedicated workforce for testing in the country. And you know that if you read the plan, it will employ a 3,000 strong workforce. That's in the plan. That specific figure is in there. Currently, the HSE is recruiting 700 people to take swabs and 500 contact tracing staff. Those are specific figures in the plan. You know that. Yet you choose to deliberately distort and seek to mislead in relation to it. It talks about 30 test centres, minimum 1 test centre per county, 6 pop-up fleets, a number of dedicated contact tracing centres, and also the response to clusters as they emerge. So the situation on testing is very comprehensive, and there's a clear plan to expand and ramp that up even further. And in relation to the overall plan, it is a good plan in terms of the 5 levels. It's one of the first of EU member states to come up with a comprehensive plan of this kind. And in relation to Dublin, the advice that was presented to us by NEFIT has been adopted by government and made public. And NEFIT, as I said yesterday, may come forward with further advice on Thursday in relation to that.
Time is up, please.
So, thank you, Account Corder.
Deputy McDonald.
You may have heard GPs, actually Dublin-based GPs, on the media early this morning, setting out their concerns at the delays in accessing tests and the further delays in results being returned. Now, you may choose to adopt a defensive posture and to attack me, but I am assuming, I'm working on the supposition that you will take the word of medical professionals, and they're not inventing these scenarios. These are doctors who deal with patients who present when they're sick, as I did. I had this experience, Taoiseach, and they're not in the habit of making things up. The only person engaging in wishful thinking, it seems, is yourself and your government. I want to know when we will get to 100,000 tests a day. I have my app here, and it reflects over the last 7 days, we're way short of it. And last week, and the week before, and the week before that, you made the commitment of 100,000 tests a day. When will you get to that? And the 24-hour turnaround testing. And as for Dublin, Ceann Comhairle, I have to say, Taoiseach, your words today add to the confusion and the anxiety across the county. Neffish gave you information and advice, and you've put it into the public domain. Well, I have to tell you, all you have achieved is to cause confusion, and you haven't been on your own, because other ministers in government have caused confusion too. So clarify matters now. Precisely and succinctly set out the travel advice for people in Dublin. No, you're the Taoiseach. You are the Taoiseach. Set it out. Your ministers don't know it. The community doesn't know it. You're the head of government. So instead of snapping at me, actually do your job and set the information out.
Could I just ask members, please? We have prescribed times for these questions. I don't want to be at odds or at issue with anyone. Additional time has been allocated to Sinn Féin. Now, we have gone over that allocated time. And Taoiseach, I would ask, can we please, all of us, try to stay?
Additional time based on our political strength, just to state that for the record.
Well, yeah, sure. That's obviously why it's happening. Why else would it happen? Yeah, it's not favouritism that we're operating on the basis of. So, Taoiseach, could you respond, please?
Well, of course, Ceann Comhairle. Between the 1st of July, in the 7 days up to the 13th of September, Deputy, there were 74,796 COVID-19 tests completed. That's the highest number of tests in a single week since the beginning of the pandemic. Okay, that is significant ramping up. The pressure since schools came back has been quite significant. That's normal. That is to be expected, and the system is coping with it. And in relation to Dublin, you know full well the advice. I said it here yesterday in the Dáil. And you know full well what the advice is, and I'll say it again. Those living in Dublin should be encouraged to limit travel outside of Dublin, if possible. I mean, outside the county, they should not meet with more than one other household. That's the advice from NEFIT. That's the advice we've endorsed, and that's the advice that's out there right now. There's not a regulation. There's not a legal restriction. That is the advice. Encourage people not to travel outside of Dublin. Of course, you knew that. But you just wanted to come in and say confusion, chaos, this, that.
Thank you.
You just want to keep.
Time is up.
You keep on doing. No, you keep on doing that. That's the mantra, and that's what opposition do.
Time is up. Taoiseach,
but I think you were asked, and I facilitated a briefing with the HSE on testing. Now you were presented with the figures from the HSE Chief Executive Officer, and I think you're doing a disservice to the work of the HSE in relation to this.
Please,
you are.
The time
I genuinely think you are, and your entire. I think, approach to all of this is not to seek clarity, but rather to undermine, not to amplify public health measures, but rather to undermine them.
Do you know what? If people are, with all members, please, do you know what? We can tear up the rule book and do what we like in here if we're not going to adhere to the rules that you the members, put in place. Please, can I plead with you to adhere to the time limits.